So I'm going to talk to you about diabetes and oral health. So what I'm not going to go through the diabetes and the pathology of all of that, but I'm going to concentrate on the things that affect your mouth in specific relation to diabetes type 1 and 2. And namely, these are things like gum disease, advanced gum disease. And the difference between the two is that gingivitis is the regular gum disease, which can be reversed. And you've got gum disease, which is quite advanced and can't often be reversed. The other things that affect the mouth are thrush, salivary gland dysfunction, or healing that can be affected, as you may know already, in different parts of the body after certain surgical procedures. So this summarizes technically all the things that are related to the relationship between diabetes and oral health. It's quite a lot of things that are involved here. So I'm going to go over a few things because I'm quite conscious of the time limit here. So first of all, let's talk about healthy gums in general. So healthy gums, as you can see from the picture, not expecting you to know any scientific terms. So they should look a bit knife-edged at the edges there, as you can see between the teeth, firm, and they should be securely in place. Your gums should not bleed when you touch or brush them, or when you're eating apples, for example. However, gum disease, it's called gingivitis, and it's when you get redness or swollen of your gums, bleeding gums when you brush your teeth, for example, or when you floss. At this stage, gum disease is quite reversible, and it's called gingivitis. It's not always painful, and it's not that you're always aware of it. And as I said before, it is reversible at this stage, and you must visit the dentist regularly and follow their advice. Now, this is what gingivitis looks like. If you can see the teeth, and just at the top of the upper teeth, it's very clear that there's a red mark on the gums, and that's basically what early gum disease will look like. I have to say to you, some of the pictures can be quite gruesome, so apologies, but it's important that we get this across so you can recognize these things. So we talked a little bit about periodontitis, which is an extremely chronic form of the gum disease that I talked about earlier. So if gingivitis is left untreated, then it progresses to become periodontitis. And this is where you are going to get symptoms such as bad breath, a funny taste in your mouth. You might feel that your teeth are becoming loose and eating is becoming increasingly difficult. It may also progress to collection of a pus, sort of white, creamy type of liquid that comes out of your gums, and that's advanced gum disease then. So this is a picture, again, apologies for the pictures, but it's important that we get this across, and this is advanced gum disease. As you can see, compared to the other picture that we showed before, this is nice, healthy pink tissues, and then compare it to this, and you can see that, this swelling of the gums, there's brown stuff on your teeth, gums are not looking very, very happy there. So that's advanced gum disease. There's also another form of gum disease, which is quite rare, and it's extremely chronic, where it just sudden onset of severe gum disease, and it can come about anytime, sometimes randomly, even for young people without any medical conditions such as diabetes, and that is basically an enhanced form of what you get here with your chronic gum disease. So you're going to get a lot of bad breath, lots of ulcers in your mouth, metallic taste in your mouth, saliva, which is too much in your mouth, and swallowing and talking can be really, really difficult. And this is what it looks like. So it doesn't look that dissimilar to that. And this you're going to know about this if you ever get this. So with gum disease, there is a synergistic relationship. So if your gums are healthy, you're more likely to have controlled diabetes. And there is the opposite, inverse relationship, where gum disease is it's like a bidirectional relationship, where if your diabetes is uncontrolled, then you're also likely to have very bad periodontal or gum disease that we've said. So there's an inverse proportional level of glycemic control with periodontal diseases. So it's important then that I tell you that these facts, where did you know that if you have diabetes, you're 3 times more likely to develop gum disease? And in turn, it can, gum disease can then lead to high sugar, which then causes more complications in your diabetes, and it makes it harder for your body to fight infections. And this, of course, includes gum disease. One of the other things that affect, moving on from the gum disease now, is a fungal infection, which is what we call thrush. And that's basically where you get a fungus, which you normally have, and that's called Candida, which is quite common for us to have everywhere in our body, but especially in the mouth. It's just not part of your normal flora in the mouth. And unfortunately, it's one of those, it's an opportunistic infection, where if you have uncontrolled diabetes, then the presence of this fungus increases in vast proportions and you get thrush in your mouth. So if you're wearing dentures, which is an appliance for missing teeth, then you're more likely to notice these kind of things. And the symptoms of having Candida, a fungal infection in your mouth, can be white patches on the insides of your cheek, white patches on the tongue, like a roughness feeling on your tongue or throat. And it feels like there's like a blanket of cotton in your mouth or on your tongue. You can lose taste because your tongue is covered with these white patches, and you can have pain when you're eating or swallowing. There can also be crackling of the sides. So this is the kind of thing that we're looking out for. This is a thrush infection where the fungus has overgrown. And again, this is the furry sort of blankety tongue. And sometimes it can present as sort of redness at the corners of the mouth as well. So to prevent Candida in the mouth overwhelming and becoming a problem, you have to maintain a good oral health, rinse your mouth or brush your teeth after, if you have asthma as well. Because the steroids that you might, the pumps that you might be using for your asthma, for example, they have steroids, and that causes an increase in thrush as well. And we'd advise that we, keep the tongue clean as well. People forget that keeping the tongue clean is also an important part of your oral routine of hygiene routine. And you must, as I'm going to emphasize, visit the dentist regularly. So moving on from now thrush in the mouth to a different type of oral condition, and that's called xerostomia. It's where you basically get dry mouth. Now in diabetics, what usually happens is that this is type 1 or type 2, you get high blood sugar, and that's known as hyperglycemia. And what happens if you get too much sugar inside, it can cause symptoms of dry mouth. And it's just one of those things that the salivary glands, that you've got 3 sets in your mouth, and they just secrete less saliva, and the whole and it is affected somewhat in diabetes, and they don't make enough saliva. So that's really important for obviously taste, moving food around the mouth. And you will again get these symptoms of bad breath, burning feeling in the mouth. It's like almost like sandpaper when you're eating. Difficulty with eating, so chewing, swallowing, cracked lips, nearly dry all the time, soreness. And when you get dry mouth, that is accompanied by other dental factors, which I'll talk about later. So if you do experience dry mouth, it's important that you consider having less drinks with sugar in it, and drink plenty of water. Things like sodas, juices, candy, other desserts, even ketchup will have lots of sugar in it. And dry mouth is a complicated thing that we can treat with certain medications, but it's usually from lots of patients taking lots and lots of medications, and the more medications you take, unfortunately, the side effects of those medications is a dry mouth. So I'm not going to read them out, but there's quite a lot of things that we would advise people to do if they do have dry mouth. But ultimately, the most important thing is that make sure you go to the dentist quite regularly, because if I can explain to you that having saliva in your mouth washes down all the food debris that you eat, and that includes saliva. So if you don't have saliva in your mouth and you've got dry mouth, the sugar isn't being washed away. So, and of course, with diabetics, there's also lots of sugar in the blood naturally, and that can cause plaque in the bacteria. That can cause plaque to form, and plaque is basically where you get bacteria and it mixes with the sugar, mixes with the little amount of saliva that you've got, and it starts forming some acid, and that's what plaque is. It's acid mixed with the sugars in your mouth and the bacteria, and that's a really important factor where diabetics do have a higher concentration of sugar in their saliva. They're more susceptible to tooth decay. So if I just show you a little diagram where the sugars mix with the bacteria to create the acid, and the acid then attacks on the tooth surfaces, and tooth surfaces are mineral content. So if you put acid on a mineral content, you're going to start to create holes. So here's a little diagram on the top left. We see early tooth decay where you've got that acid formation. You're breaking away the top layer of that tooth, which is the enamel. And then if you look on the top diagram on the right hand side, and that's tooth decay then progressing further down into the tooth, and causing decay into the second part of the tooth, which is the live part of your tooth, and that's the dentine. So you're not going to feel decay when it's early. If you check back with the top left picture, early decay is almost, it's not reversible, but we can certainly arrest it at that point. So if your dentist catches that early on, they can give you some preventative measures such as fluoride toothpaste. They can give you oral hygiene instructions, making sure that you're not allowing buildup of that plaque, so that it stops there. So at that point, it's reversible. However, when it gets to your top right picture, when it enters the tooth decay enters decay, the dentine, then unfortunately, that's when you're going to start to get symptoms. And if it's allowed to further progress, where you look at the bottom left picture where it says advanced tooth decay, that is where the nerves of the tooth actually sit. So if it enters that, then you are going to then need a root canal treatment or extraction of that tooth, because it can be really, really painful. And then after that, if you still have left it and it advances to the bottom right picture where it says abscess tooth, then that's when you're going to start getting swellings next to your teeth. And obviously, most likely the treatment of that would be to have your tooth extracted. So I have talked about tooth decay, and this is what it would look like in the teeth. That is a severe form. Obviously, we don't want it to get that far. So if you do notice any, brown areas on your teeth, please do make sure that you get that checked out. Sorry, there is a picture on there, but I've not edited it. So if you can have a look on the top, the left-hand side, that's a picture of an abscess. So that's the bottom right picture where it says abscess tooth, and the abscess would show up on the side. And of course, then there's no treatment for that tooth apart from having it taken out. So treatment for tooth decay, if it's early stage, then obviously your dentist can, fill the cavity with a filling. And of course, reduce this, as a diabetic, I'm sure you're aware of the, reducing your sugary foods and drinks to prevent that happening. Make sure that you brush your teeth twice a day. And I have mentioned very briefly that your dentist might give you a fluoride toothpaste as a prescription. And fluoride is a very important mineral, and it helps prevent decay if it's early, and it or stops decay if it's early on. And it also in the later stages where it reaches inside the tooth, it can arrest it at that point. It will never reverse it once it's gone through to the deeper layer of the tooth. And there's various other treatments that can be done. So, we would definitely advise that you go and see the dentist regularly so that they can check if there's new cavities forming, then they can give you the correct advice to stop the cavities from forming. They can also do some x-rays, and the x-rays would show up the decay as we showed in those pictures before. The other thing that can affect diabetics quite a lot is dental extractions, and this is basically my expertise now. There's actually no harm in removing a tooth if you're a diabetic and your diabetes is well controlled. There are studies that show that a well-controlled diabetic has no difference in the healing capacity than somebody with no diabetes. There are obviously complications of hypoglycemia, where the sugars are low in your system, or hyper, where the sugars are high. So if you go to an appointment with a dentist and they're about to take your tooth out, then having your sugars checked, especially if you're uncontrolled diabetic, is very, very important. Because if you're too high, if your sugars are too high, it's going to cause you a lot of stress. If your sugars are too low, then you're going to most probably faint at some point, along with the stress of actually having the anxiety of being at the dentist. So it will temporarily also temporarily increases blood sugars, and that can affect how you are at the appointment as well. And of course, after you having your extraction and you go home, there's long-term effects. There are higher risks with diabetics of delayed healing after extractions if the diabetes is uncontrolled. And one of the infections that you can get after a dental extraction is a dry socket. A dry socket is an infection of the bone. Once you've had a tooth removed, there is a socket that's inside where the tooth actually sits. And you're supposed to, for natural healing, you're supposed to have a clot formation. So you'll notice that as soon as a tooth is taken out, you bleed from there. And that blood is very important because it will aggregate into a spongy sort of clot. And that clot is what will eventually turn into gums. So it has to be left alone there. If for whatever reason it doesn't form, as is the case in some diabetics, especially uncontrolled diabetics, then the socket doesn't have the nutrients it needs to recover. And so the bone will get infected, and that infection is called a dry socket. Some people, they do get the blood clot, and for whatever reason, they might have washed it away. Again, in a diabetic, that healing is going to be so much slower if the clot is removed from there. So dry socket there are more dry sockets in patients with uncontrolled diabetes. And this is what a dry socket would look like. It's where the bone is the gray part in the middle. There's supposed to be a clot present in there after a dental extraction. However, the clot is missing, and the bone starts to cause a lot of pain, and it's infected on the sides. It looks like there's an ulcer all the way around that socket where the tooth has been extracted. So if this is the case, then you must obviously visit a dentist again. And the symptoms of a dry socket is pain in the jaw or the mouth about 3 days after you've had an extraction. Funny smell, bad breath, and as I said before, visible bone in the socket, and the pain is excruciating. It's often more painful than the pain that you had from the abscess itself. So this is a very, very painful thing to have in terms of a dry socket. So I did explain before that on this picture, you can see on the left-hand side, the blood fills into where the tooth used to be. And on the right, there's no blood there. And that's when you likely to get a dry socket. So I have covered quite a lot of things very, very briefly. gum disease. Gum disease is very, very prevalent in uncontrolled diabetics. There's thrush, which is the white patches, and it's an overgrowth of the fungus that's already in your mouth, commonly known as Candida albicans. And although it's meant to be there in sort of normal numbers, it overgrows in some people with uncontrolled diabetes. There's delayed healing, especially after extractions, is also another risk, and saliva flow reduction is a risk. And of course, dental decay. So all of those things, are very important factors in diabetes. So oral health is one of those things that we can use to diagnose diabetes. And again, it's one of those things that, I mean, you're all people that are listening to me are diabetics, but if you go to a dentist and they see signs of extremely poor gum health, or certain things that are not correct, for example, non-healing after an extraction, they can flag that up to your general medical practitioner and highlight that they suspect that this is we're suspecting that there might be diabetes here. So it is extreme. As part of healthcare system, dentists are able to help other healthcare professionals in diagnosing diabetes as well. So yeah, I think that's it. So I'm done with my talk. Thank you, everyone.